oral graft-versus-host disease, or typically what we refer to as oral chronic graft-versus-host disease, much more common than the acute presentation. I think first and foremost, important to have the correct diagnosis. In most cases, this diagnosis is not so difficult to make, but it is not always the most obvious. And importantly, that diagnosis can also provide a systemic diagnosis for chronic graft-versus-host disease, according to the NIH consensus criteria. So in diagnosing a patient, one must determine what needs to be treated or whether or not it needs to be treated at all. In some cases, a patient may be on systemic therapy, and that systemic therapy may be adequately addressing the patient's needs in the mouth, or perhaps not, or perhaps the patient doesn't require being on systemic therapy. Once these considerations are in place, it's important to understand what the patient's disease manifestations are. So is this a patient presenting primarily with mucosal disease, with lichen planus-like changes inside the mouth? And if so, are they symptomatic? And if they're symptomatic, these patients will most likely benefit from a topical steroid regimen. And there are a number of considerations as far as how to choose a topical steroid and how to best administer the topical steroid, and to be aware of potential side effects of the topical steroid therapy. The patient is presenting primarily with salivary gland involvement. They may not have any lichen planus changes in the mouth, but the mouth may be very dry. These patients may benefit from a number of over-the-counter types of interventions, even just good hydration and finding ways to keep the mouth wet, in addition to the use of systemic sialagogue therapies, which can actually be very beneficial for some patients. These patients may also be at risk for developing other complications like dental caries and recurrent candidiasis in the mouth, which can also be further complicated if a patient is using topical steroids, another risk factor for developing candidiasis in the mouth. And so these patients may require somewhat of a holistic approach in managing not only symptoms, but potential complications of treatment and or complications of the chronic graft-versus-host disease itself. Patients also require long-term follow-up, not only for the potential complications of dental caries and following up of disease response, but also important to keep in mind these patients are at an increased risk for developing a secondary squamous cell carcinoma in the oral cavity, which we believe to be fairly highly associated with the presence of mucosal chronic graft-versus-host disease. And so this is a complication that may develop years after a patient's been diagnosed and treated. In some cases, patient may have had a period where their disease is actually completely quiescent, and then may develop some sort of new symptom or simply just new lesions in the oral cavity, suggestive of or diagnostic for cancer.